Good afternoon, everyone, and thank you for joining us for this virtual briefing about COVID-19 and the pandemic here in the city of Richmond. The city of Richmond is currently still in phase 3 of Forward Virginia, the governor's plans for reopening. Governor Northam's most recent restrictions on gatherings of 25 or more are in effect this week. So please do keep that in mind as you make plans for this Thursday and your holiday weekend. In the city of Richmond, workforce, 27 employees are currently in quarantine, and there are currently 12 confirmed positives. And as of this morning, the Richmond City Health District is reporting 6,384 total cases of COVID-19 since the beginning of the pandemic. 80 Richmond residents have lost their lives because of this disease. Please join me for a moment of silence to remember those we've lost during this pandemic. Thank you. This briefing will be quite short today as we head into the holiday weekend, but I wanted to take a moment to just reiterate some of the guidance that not only the CDC, but the Virginia Department of Health has provided for us as we go into this holiday. I approach this holiday with a lot of gratitude. This Thanksgiving is a lot about gratitude, and it's one day dedicated to showing appreciation for what we may take for granted the other 364 days out of the year. I know that this year has been incredibly hard, so it may be more challenging than in years past to be grateful. But if you haven't lost anyone you love during the pandemic, then you have something to be grateful for. I ask you to pay that forward, extending the grace that has been afforded you to keep our community safe. I urge you once again not to travel, but if you do, to take the precautions necessary, wear a mask and stay 6 feet apart. I urge you not to meet in large groups. If you do, it's safest to meet outside and stay 6 feet apart, social distance. And whenever you're not eating, please continue to wear your mask. And also, I urge you to stay home as much as possible. This is the key, especially in the couple of days we have during the holiday. You are safer and stronger at home, especially if you choose to travel over the holiday. This year, once again, I'm thankful for the city, the way we have grown closer through trauma, challenge, and hard conversations. I'll be showing that thanks by prioritizing the health and safety of myself and others this holiday, and I hope you will do the same. Dr. Avula will now provide an update on the city's public health status. Dr. Avula.
Yeah, thank you, Mayor. Good afternoon, everybody. We continue on the trend that we have talked about for these last few weeks in the city of Richmond, where each week we see more cases per day than the week before. And this week we have surpassed the highest peak that we have experienced as a city at any point during this pandemic back in June. We are now averaging, our 7-day average is about 56 new cases per day over the last 7 days. And that surpasses the previous peak of around 54. As I shared last week, I anticipate that this trend will continue over the next couple of months. I think it's inevitable that both the combination of holiday gathering and indoor time spent pushes us further and further down this road. And some of the things that I shared concerns with you all about last week, we're starting to see happen, particularly the circulating disease in long-term care facilities and in nursing homes and assisted living facilities. If you look at our dashboard, you'll see that there are a number of new entries, new facilities that have experienced, the entry of disease, and largely this is happening because of staff, and it's staff that exists in communities. And when we see more circulating disease in the community, we have a higher risk of those staff unknowingly contracting COVID and then transmitting it to our high-risk individuals in long-term care facilities. And this is happening before we really have an opportunity to prevent through vaccination. And so, everything that we can do, as the mayor spoke about paying this forward, everything that we can do to limit spread will cut off that ripple effect to present disease into high-risk situations. Our percent positivity in the city continues to be relatively low. We're at 4.8% over the last 7 days, but that has, that's slowly ratcheted up. And so another data point that we need to keep eyes on, as well as hospitalizations. Now, remember that hospitalization data typically lags about a week or two behind case rates. And while we've seen a slight uptick in hospital numbers, our capacity continues to be good. We're currently at 31% occupancy for our ventilator beds in the region, and so still plenty of capacity there. I think I shared last week that because of the demographic shift that we've seen in the data to younger and healthier people, my hope is that we don't see as many hospitalizations over the next couple of months, but we still need to be vigilant there. We have continued to see cases identified in schools and in private schools in particular, and this has been the case throughout the pandemic. And but the important note to make there is that we are not seeing a lot of in-school transmission, right? Much of the cases that we're seeing are people who contract COVID in their day-to-day activities and their socializing outside of school. But when they come into the much more regulated environment of schools in session, we're not seeing spread in the classroom setting by and large. But regardless, the reality that we're seeing more disease in the community means that we're going to see more disease coming into schools and have to be able to prevent against spread in those settings. And the last point I'll note is really around vaccination. I shared some good news last week that continues to kind of head down that track. AstraZeneca, another vaccine candidate, posted some encouraging numbers. We're still really trying to parse out what their effectiveness data means. They have two different concurrent trials that have two different efficacy rates. And so we'll see where we end up on the AstraZeneca news, but Pfizer at this point has submitted their emergency use authorization application. The FDA will meet on December 10th to make a decision about that. And the White House is saying that they are ready to ship within 24 hours of an authorization. And so it is looking more and more likely that we could potentially have vaccine on the ground here by December 12th or so. So our team continues to work feverishly in identifying, who are the different tiers that would be prioritized for vaccine. And we also recognize there may be some scenarios where the tiers that I've shared, so that first tier of frontline healthcare workers and long-term care facilities, we may not get an initial allotment to cover all of those. And so we really need to apply both a public health framework and an ethical framework to determine how that limited vaccine will be distributed. And so we're working on that and kind of crunching numbers, figuring out exactly how many individuals fall into each of those categories, and how that will impact our distribution and our staff, because in some cases our staff will end up having to do some of that vaccination. Yeah, so I think if I end with anything, it is that a continuation of the message that we've been sharing throughout COVID, which is that the stakes are high, and right now more than ever, more than any point during this pandemic. And so we really encourage everyone to be safe and to maintain distance and to wear masks, and to really think about not just who the close inner circle that you may be being exposed to, but what is the potential trickle-down effect to other vulnerable members of our community.
Okay, now we'll open up to questions, and I'll hand it over to Sam to direct. Go ahead, Sam.
Thanks, Mr. Mayor. Let's start with Chris from RTD. I want to ask about a different topic. The Reimagining Public Safety Task Force, that report came out last night. Mayor, if you could tell us how soon do you plan to implement some of those recommendations?
Well, Chris, I think that the report is fantastic. I'm grateful to the activists, the advocates, those who have expertise and who came to the table to create this document. I think there's some actionable items that we could actually put into works right away, and some of it's going to need a little evaluation as well. And so we're going to do what we can early, but also we're going to also evaluate and see how we can go chart out a course to ensure that we actually bring some of these recommendations to life. I'm a big fan of what I saw from the Human Services Lens Group on how we go about creating a community of care team, basically, that will allow for us to respond to some of these non-criminal events with community voices and people who have an expertise in mental and behavioral health. These are some of the items I talked about when I was running for re-election, and it's my hope that working with a number of people at the table that we are able to bring this to life sometime soon.
Okay, up next, Alan from VPM.
Thank you. I have two questions for Dr. Avula. The first one is about testing. We have heard that there's been some testing shortages, and some people have had to go out of city to get tested. So I'm wondering if you could just give us a quick rundown of the state of testing in Richmond as far as availability and access is concerned.
Yeah, thanks, Alan. We are actually just hearing this as well in the last day or two that many of our, many of the places that have been doing much of the testing are urgent care centers and our retail pharmacies and even private providers are really seeing an increased demand of testing. And so not only is just the number of appointments available, but they're also concerned about testing supplies. So I'm just now trying to get my arms around how significant that shortage is. In fact, I was just texting a physician who reached out to me just a few minutes ago saying that their practice is running low on testing supplies. So I'm aware of it, and we are. I need to get the team together this afternoon to assess who's short and how we can close that gap with some CARES Act dollars. I think that there will be opportunities, particularly with funding that has to be spent by the end of December, to purchase testing supplies and to get those to our providers out in communities. But we may see a short-term backlog of testing availability, but let's stay in contact about it because it's pretty concerning.
Great, thank you. And then my second question, just a quick follow-up. You mentioned that in schools, private schools in particular, are seeing cases. Is that disproportionate to the number of students that attend private schools? And can you elaborate a little bit on why private schools in particular are seeing this increase?
Because private schools are back in person and public schools here in Richmond and Henrico are not yet. So the reporting happens quicker when they're in the school context because our folks get involved with schools as soon as they report a case, right? We help them with the contact tracing and case investigation. We identify what staff and students, if any, need to be quarantined. And so it's not at all disproportionate. Really what it's proportionate to is the amount of disease we see circulating in communities. And so when there's more disease in community, there's greater opportunity and greater likelihood that you're going to see cases in the school and in every setting, frankly, and workplaces as well. So I mentioned specifically the private schools just because that's where we have schools that have been in session since September, and it's where we're pursuing a lot of activity right now. What are the implications? I think that what schools are thinking about on a school by school basis is, much like the universities have, should we take a longer session in the winter to allow some of this die down and then have kids coming back? So I don't know. I think a lot of those decisions will come in the next couple of weeks about how, and I think every school will handle it differently based on the amount of activity that they're seeing.
Cool. Thank you.
Thanks, Alan. Okay, Alex from 8 News.
I have a question for the mayor. So following up on Chris's question, for the more, I'll say, logistically challenging recommendations like the nonviolent calls you mentioned, are you expecting it'll take months, up to a year, longer than a year to really see one like that implemented? And then also, are there any recommendations that you read through and are not on board with?
Alex, great question. Here's the thing, I'm not going to put a timeline or a timetable on some of these recommendations. Some of them will need to be evaluated, and some of them will be actionable ASAP. However, I think that we owe it to those who worked on this plan to be thorough in our review of the recommendations, and those that can be actionable as soon as possible to enact them quickly. And that's what we're committed to doing. And I have not seen anything that I fully dislike. My team briefed me on the report. They know my values and where I stand on public safety. And obviously these are recommendations, and we'll be responsible for implementation and execution of some of these recommendations. But that is something that we will obviously be very deliberate about. And you can expect that many of these items that were recommended will actually turn into reality.
Okay, thank you.
Mm-hmm.
Thanks, Alex. Okay, let's go to Cam from Channel 6.
And Mr. Mayor, again, just to follow up on Chris, to follow up on Alex here, for these actionable ASAP items, which of those 15 fall into that category? If you give us some more specifics.
Which of the 15?
You said that some of these are going to take longer. You don't want to put a timestamp on those, but you talk about some of these being actionable ASAP. So which of these 15 do you see sort of within that short frame?
What I want to focus on is what I took from the report is how we go about training the police officers who are currently employed by the Richmond Police Department. These are changes, policy changes that I think that we can institute as soon as possible. Obviously, a lot of these recommendations will also be connected to funding as well. And so, as I've stated in the past, I want us to fund the change and fund this reimagination. And so we have to be committed to that. And that's going to be not only take me, it's going to take the help of the city council as well.
Okay. Sorry, I think we've gotten through everyone.
Are there any more out there?
I just wanted to follow up on one thing, and
Sure.
again, talking about this task force report, there's a specific recommendation regarding the police department's budget. It says the administration should review, analyze, and find opportunities to reallocate some of that money to contribute to greater investment in the community. Now, I know it doesn't explicitly say defund the police, but when you had some counselors promote a resolution similar to that over July, that got shot down, and some of the counselors phrased that as basically a defund the police move. What do you think of that recommendation specifically?
Well, I don't believe in defunding the police, Chris, and I've stated that in the past, and I believe that we have to fund the change. We have to fund the reforms as well. And some of those reforms will live in other agencies. They will live with other organizations that, who can support us bringing about this human services lens to public safety. And that's what I think we have to do. I have obviously no problem with an analysis of an agency that is a part of city government. Those analyses happen pretty annually during the budget process, and there'll be we are obviously willing to respond to anything that the city council would request of us. But for me, I think our focus will continue to be on funding the reforms and the changes we want to see in our police department. We're an accredited police department, but the accreditation I want to see is that from the community. And this is, I think this is just a part of that with the reimagining of Public Safety Task Force.
Okay, thank you all very much.
Happy Thanksgiving, everyone.